We are going to get started with our next presentation, which is a very popular one. You are going to just want to listen to Mayra Thompson for the rest of the afternoon, but we only have a short time with her, and we're going to be talking about Catholic bioethics. And so I give you Mayra Thompson to talk about the quality of life and the dignity of the human person. Thank you, Mayra.
Okay. Good morning. What Anna just told you is exactly right. I could talk probably about 4 or 5 hours on this issue. We could all have wonderful discussions, probably have 3 glasses of wine in the middle of it, and not be done. And that is because it's a very important issue, and this is something we talk about under many circumstances. My name is Mayra Thompson. I am a board-certified OBGYN, been practicing in Dallas. I hate to say it, but it's true, 40 years now. And I'm Catholic, cradle Catholic, and one of the things I love talking about is what we do in healthcare that actually is approved by our Catholic Church and our Catholic beliefs. And I hope today to share with you some of the things that are important in our religion as they relate to our health. And as we get older, we all know that things are not as easy as it used to be. I know for a fact that things hurt more. The other day I moved some furniture in my house, and when I was done, I said, I can't believe how tired I am and how everything hurts. And I realized, I guess I am getting older. So these issues are important to all of us. And the things I'm going to talk about today are extensive. I'm giving you an abridged lecture today on a lot of topics, but my slide packet that has been included in your folder is a more thorough explanation of some of the things I'm talking about. And they're included so that you can refer back to them when you have questions about the things that I have stated or clarification. Catholic Foundation does allow for you to send questions, which I can address if needed. Unfortunately, today we are limited in time, but I would be happy to address any questions at the end of the presentation today. But also, if you think of something later on, you can always send it to our website, and they will get the question to me, and I will respond to it. So we're talking today on the bioethics of which are Catholic. And what does that term mean? The term encompasses 2 specific things. The ethics of the biology of the human body, something we as medical students learn in our preparation to be doctors. We learn biology, but there's something in addition to that, which is the ethics or the moral value of the things that we see in biology. And also it encompasses the religious doctrine of the Roman Catholic Church. We must remember this when we think about these issues, when we practice medicine, especially considering our religion. We as Christians believe in the protection of human life from the beginning to natural death. That is now known as from the womb to the tomb. Today we're going to be addressing the issues that are more related to the end or the tomb than it is the womb. However, we need to know that human life must be respected and protected absolutely from the moment of conception. A lot of discussion is stated that life does not begin at conception, but we as Roman Catholics Christians believe that it starts at that point because the biological sciences show us that that is when reproduction of the cells starts. And you can ignore that fact or you can accept it, but we as Catholics accept it. The human life represents personhood, and that is a very important concept. And that states that the personhood has inalienable rights in conformity with the plan and will of God. Research has now been shown that when you see an embryo developing, there is a definite distinction in how that embryo forms. So there is a difference, and we call that personhood. It's a development that differentiates it from a plant, from a tree. You can see things under the microscope that divide and reproduce, but it is different than the type of reproduction we see in the human. And that has a relation to the term personhood, and that's a very important term that we have to use to protect it. The Catechism of the Catholic Church is something that we all can get a copy of, which delineates in several statements what the Catholic Church stands for. The Catholic Church, in its wisdom, has published this, and in its composition has included certain topics which we are now, which are showing its relativity in relations to the practice of medicine and healthcare issues. We also know that the Catholic Church addresses some of the topics when they consider science and technology. If you look at other religions, they may not address it. They have their theoretical religious doctrine or beliefs, and then here's science and technology over here. And they don't seem to intertwine. There's differences, which causes confusion in the followers of those religions. However, our Catholic Church has gone from ignoring these issues to now saying we have certain stances that we have and statements and beliefs that we are using not only to share with our clergy and share with our medical community, but also to our people, our congregation, which helps them understand why we believe and practice and state what we do. And what the Catechism says in this verse, or section 2294, is that science and technology, by their very nature, require unconditional respect for the fundamental moral criteria. And they must be at the service of the human person, of his or her inalienable rights, of his or her true and integrated good, in conformity with the plan and will of God. Again, we talk about personhood going along with this catechism, and we say that respecting the dignity of the human person depends on the understanding of what that term personhood means. I stated a little bit generally what it says, but we must understand that personhood involves the understanding that a person is an individual who is of a rational kind. Well, what does that mean, a rational kind? It means it's an individual who can reason. We know we have little pets that we love. I have a pet that I adore, and the pet knows that when I say, Benji, it's time to go potty, Benji has learned that the word potty or that sounds means that Benji must go outside. But does Benji really understand that going outside avoids dirtying my carpet, or that that's not good? No, Benji doesn't understand that. But what we see in our human people is that humans do have the ability not only to take fact A and fact B and understand it, but they can come to a conclusion which is now C. And that the ability to reason and to act on those rules, regulations, or findings or facts is which makes them different than any other entities that exist in this world. That ability to reason that human being has does not go away when that person becomes unable to come to those conclusions. What are those situations? Let's talk about a person who has loss of memory, loss of cognitive ability. If they had it before, like most of us have in this room, when you lose it doesn't mean you lose that ability. You have that ability, that part of your nature. It's just that your brain has deteriorated, that you do not have the same ability you had before. But that does not say that your personhood is gone. When a person goes into a coma, that person does not lose his or her personhood. They just have gone into a medical situation or condition that doesn't allow them to reason as we do right now when we're alert. But that personhood is still there. That makes them human, makes them different than animals or plants. And that's why these people deserve, or people or human beings deserve a certain quality or dignity that we attribute to them. And when we conclude what that means is we say that the personhood does not depend on the current functional abilities as I have described, what we can do, but the innate capacity for certain functional abilities, what we are. The role of the Catholic Church is very important in its desire to become important in the medical field, but it also, in the sense that it supports the healthcare ministry, and it must collaborate with those who work to improve the health of the congregation. I very, very frequently had in the past gone to speak to my priest or someone who I felt had the moral knowledge that I didn't have as a doctor as far as religious things, and I would go for guidance. And what I found is a lot of the clergy that I spoke to did get some of their statements, beliefs, guidance from the Catholic Church, which had published certain statements that they were able to give me in support of any actions that I had. Because the clergy and medical community both have a job that intertwines. We have to offer health care, but they have to give us the religious and moral backing so that we know what to do in certain conditions. And the role of the church is to sort of coordinate that effort and to make sure that they help us talk to each other, work together, and for those of us who don't have the knowledge, give us the knowledge so that we can work together. They provide clarity in problematic situations before and after birth, throughout life, as well as the end of life. And they are committed to the education of the clergy of the moral issues as well as to technology, and also to us, educate us in the medical field regarding what issues the clergy may have with things that we may have studied that may not always be in agreement with what we should believe. The principles of the Catholic bioethics define our moral obligation. And what does that mean? Well, there are 3 moral obligations. And when you think about moral obligations, we talk about things related to ethics, things related to what we believe in regards to our religion. So we consider that we do not commit evil. We are called to always provide good. And I don't mean that term that is overused for the greater good. I'm talking about good and bad, black and white. There is no such thing as getting generalized here. It's what is good. And we all know what is good. We're guided from the time we're children by our parents to say, no, you don't do that, that's bad, or no, you do this, that's good. And I often tell my kids, now that I see my grandkids, and they're afraid to tell them what's good and bad, I go, they need a black and white. That's good and that's bad. If you put your hand on something hot, you're going to burn yourself. Don't tell them, oh, you might. No. You say it's good or bad. So we know that we must not commit what is bad or evil. That is the rule. We prevent evil out of charity. What does that mean, prevent evil out of charity? Well, we don't want to do something that is bad because we feel that's a charitable thing to do. And I'm going to go through some of these examples, but let me give you an example that I did encounter when I was a professor at Parkland, when I was watching the residents and the medical students, where a lot of them talk about the fact that the patients have a lot of children. They have big families. What do they have? What business do they have having big families when they're poor? They can't even afford a hospital bill. They're here at Parkland. They should be given some form of preventing pregnancy, and if they don't agree to it, we'll just do something to prevent it without their knowledge. And if you don't think that that's being said, let me tell you, you're wrong. It is. And it is up to people who know that that is bad to point it out, which, as you can probably tell, I'm not shy. I've already shown that, right? I say that's bad. And when I say, what do you mean it's bad? It's bad because you're telling people, you're making judgments for them. Now, if you think that they're maybe mismanaging their funds or they're maybe not making wise decisions, you may try to talk to them about maybe helping them in making better decisions, but don't tell them that they're not allowed to do something, or worse, do a procedure on them that takes their choices away in the name of charity or good. That's the point of that. That's an example that's very, very, let's say, egregious, but I want to show you that this can lead, that kind of idea of doing something charitable, which is evil, would actually be something that would be harmful to these people and not charitable. And one thing that is a thought that maybe we don't always consider is correcting others out of charity. What does that mean? Well, a lot of us like to let people do what they want to do, right? We don't want to be the one that's the quote-unquote Joan of Arc here that tells everybody what to do, or that we're so perfect that we are going to tell people what to do. But if you see a person who is creating an injustice or acting wrong, it is our obligation out of Christianity to point out with love that that person is wrong. For example, if you see a friend gossiping about another friend, we know that that's wrong, right? We all know that. We've been taught that. But sometimes we don't want to hurt that person's feelings, so we don't want to tell them that they're gossiping and that they're wrong. It's more charitable to, and you don't want to embarrass them in front of people, I know, but it's more charitable to grab that person later and say, you know, we're friends or whatever, but I find it I don't find it charitable for you to be talking about Mary and her whatever to other people, or telling about Mary's bad behavior to the people, because that is not helping Mary, and all it is, it's doing something negative to make Mary's situation worse. Whatever way you can say it. But the point is that we must point out injustice, we must point out a negative behavior, because that is what is charity, and that is we are called to, that is a moral obligation that we have. And in order to know what is, if an action is moral, we need to kind of consider three different things. The object, and what is that? The object, what is the intention, and what is directly chosen? The intention is the reason the action was chosen, and the circumstance, the situation surrounding the action and the intention. So when I describe that whole scenario of Mary and the gossiping, I'm looking at what is actually happening, what is the intention of what's happening, and why are we hearing this? Is this a group of women talking about another woman or a family? Whatever it is, whatever we have to look at these three things and really determine if what we're doing is sound and acceptable in the eyes of our Christian belief. And I'm bringing all this up because it's going to come up. This kind of thinking comes up in the issues that I'm about to address. And that is the end-of-life issues. In the face of death, for many, a time when hope seems lost, the church witnesses to her belief that God has created each person for eternal life. We as Christians believe that our life on earth has an end, a beginning, middle, and an end. But at the end, we don't just become dust and nothing happens. Our soul goes to be with God. And we're hoping that our soul might take a little stop at purgatory, but we end up at the right place, right? I'm convinced I'm going to purgatory probably for a while, so I expect all of you to pray for me to get out of there sooner, because I know I have upset some people with my lectures. But anyway, what I'd like to say is that we all want to go to heaven, right? We want to go to heaven. But that is our eternal life, our eternal reward. So no matter how short our time is here or how long our time is here on earth, the end goal is eternal life. And the other thing that we need to remember is that each person is equal in dignity to any other, and we consider this in our term the inherent dignity of human life. All of us here in this room are equal in the eyes of God. God does not love me more than he loves you or anybody here or our children. He doesn't love the Pope Francis more than us. He loves us all equally. And it's, of course, impossible to fathom how any entity could really know every single one of us. I mean, I think about this and I get headaches. I don't even want to think about it. I just need to have faith that that's how we believe. So we all have dignity from the homeless person on the corner to the President of the United States, to the Pope, everybody. Humanity is given stewardship over life because life is a precious gift from God. We are not owners of our lives and hence do not have the absolute power over life. Only God does. We have the duty to preserve our life, to use it for the glory of God. We talk about the temple, that our bodies are our temples, and we need to protect it. That's why it's not good to be abusive of our bodies in any way, shape, or form. We shouldn't be overusing medications. We shouldn't overabuse ourselves in activities. And we have the duty to preserve life, to use it for the glory of God. And the duty is not absolute, for we may reject life. And when do we reject life? When we are offered life-prolonging procedures that are not beneficial to us necessarily, or could be excessively burdensome. And I'll go over what that means, excessively burdensome. But anyway, when we consider things that would end life, suicide, euthanasia, or assisted suicide are never morally acceptable options. That is an absolute. We will never accept that. And in this society nowadays, in pretty much in worldwide discussion, suicide and euthanasia right now are extremely, extremely popular. I don't know if you remember, but there was a movie called You Before Me, and it was a book before that. It talked about a paraplegic from an accident, a young man who fell in love with a young woman. Have you all heard of that story, that movie? And I read the book. I wanted to see what they were talking about. But basically what it was is this man went and sought out physician-assisted suicide because he did not want to live as a paraplegic. And yet this woman who came to take care of him fell in love with him. And you could see the pain in her eyes because she didn't care that he was a paraplegic. She loved him. And by killing himself, he hurt his family, he hurt his parents, he hurt her, and he mainly hurt himself because he took away the opportunity to enjoy whatever life was left. And if he'd given himself an opportunity, he would have found that the joy he got from this gal who came into his life may have been worth it. But it's such a sad, sad commentary when I hear people say that they saw it, oh, he was right to do it, because they've missed the fact that life is worth living and that life isn't our own. Physician-assisted suicide and euthanasia, to me, are the worst and most egregious things that we as physicians can do. We take a Hippocratic oath to protect life at all costs. And here we have euthanasia, which is the practice of intentionally ending a life in order to relieve pain and suffering. That's when we actually put people to death. And in some cases, we put people to death because they have mental conditions or they have physical conditions that we think they may not be worthy of living. And we saw this a lot in World War II when the Nazis were doing experiments on people that were less than perfect. Euthanasia can be voluntary or not voluntary. And I told you about that. The people are killed because they are considered inferior kinds of people as far as their bodies or even their mental capacity. Physician-assisted suicide is what physicians do. They give you medications that are lethal in order to end the life because of whatever reason. It could be cancer, it could be despair, it could be over a condition, and several reasons, but physicians actually accomplish this. And the Catholic Church has actual statements or principles that address some of the end-of-life issues. And I'll go over them one by one. They're in your pamphlet. Human life is always good. The dignity of human life flows from creation in the image of God, from redemption by Jesus Christ, and from our common destiny to share life with God beyond all corruption. We respect the good of a person's life not by killing and offering, but by offering care. Fifth commandment, you shall not kill. That's one of the primary commandments that we have. And we revere life, love, and foster it. The underlying evil at issue in assisted suicide and euthanasia is the belief that human life is no longer good, but we are taught that life is good. We should preserve life. It comes from God, and only He has the right to take it away from us. And we should accept it, and we should reject anything that is making us want to get rid of it. Persons who commit suicide are capable of eternal salvation. It's often been said, if you commit suicide, you're going straight to hell. That is not the belief of the Catholic Church. The Catholic Church does not regard persons who commit suicide as entirely responsible for their actions. A lot of these people are in despair, they're depressed. And when we consider people who say that they are going to commit suicide, we should consider that they should be regarded as pleas for affirming or asking for help, and not that they want to necessarily have death. And I've stated for you all these references of where these are so that you can see that there are several references from Catholic Church teachings. We are not required to sustain life by avoiding death at all costs. That is not what the Church wants us to do, since life is not an absolute good. Allowing death to come naturally rather than fighting it with aggressive, burdensome measures may serve a value more important than securing a precarious and painful prolongation of life by making way for serene and Christian acceptance of death, which is inherent in life. And what does that mean? That means that sometimes an illness that you have really has no solution. And if that's the case, for someone anyone to say that you have to succumb yourself to a treatment that is painful, emotionally as well as physical, and has no guarantee that you will continue to live, that is not necessarily what the Church intends or the belief of the Christian values intend. We're saying that if it is going to be difficult and burdensome and painful and overwhelmingly hard, impossible for you to sustain or tolerate, then you don't have to accept these things. You can let death come naturally. What you can't do is to take a gun and shoot yourself, or take a medicine to force yourself to die sooner to avoid the pain that comes with that, or the suffering. Hospice and good pain management respect the lives of dying people, and they should be encouraged because they focus on the comfort. In other words, hospice is for the terminally ill. What hospice does is to give you supportive care so that you have the ability to be comfortable and not continue to suffer to the degree that some of these illnesses can cause. However, it is not aimed at hastening death. It really troubles me, and most recently I hear more and more of this as a physician. I fear when someone goes on hospice, and I'll tell you why. I fear it because I know that within 3 to 4 days, sometimes even as long as 5 or 6 days, that person will be gone. It happens over and over and over again. And why is it? Because well-intentioned people, nursing staff, or family members start giving the hospice patient more and more medication, which suppresses their breathing and hastens the death, in the name of comfort. There is a very fine line that can be managed of making someone comfortable without tipping them over the edge to the point that they die. And I saw it recently in my own cousin. She's 62 years old with ALS, and I cautioned her family, cautioned everybody that these doses of morphine had to be managed very carefully when combined with something called benzodiazepines, which are sedatives, so that she could be comfortable, truly comfortable, but not dead. And unfortunately, one of the very supportive nurses that came by did not honor that and gave her a little bit too high of a dose of these medications, and within 4 days of being on hospice, she was gone. And so I tell you this because you're obligated when your family member goes on hospice to insist that your family member be comfortable but not be put to death, okay? And that's very important. And so be careful on hospice, but hospice is good. Death is the natural and inevitable end of biological life, and when we talk about death, it's called death of the total brain, including the brainstem. And there's no longer a true present human organisms, which depends on the functioning of the brain. Right now, there is a new publication by the American Association of Neurology that has redefined death or brain death, which is in discussion right now among the medical community, because some of us believe that the new definition actually enhances the ability for organ transplant obtaining, because people want a new heart, people want a new kidney or liver or whatever, although kidney and liver is a little bit easier because you can do living-related donors. But let's say people need lungs or hearts. And so in trying to define who is dead, you may better be able to harvest transplants for recipients. I'm going to go over a little bit, okay, because it's important. Is everybody okay if I go over a little bit? Okay, because I'll ask your permission. Anyway, so what I wanted to say is this. If we need to insist that the medical community have true ethical and moral reasons for changing a definition. Because if we don't, and you as a lay community and me as a medical professional, we have to combine our efforts to make sure that what changes are made for true reasons. And we as Christians, because of our protection of human life and its dignity, need to do this. End of life. In such a situation, one does not will to cause the death, but we are merely accepting the ability to impede death. It's important to make a distinction between an inability to impede death, which is what we've been talking about, and the will to cause death or direct euthanasia. A person has a moral obligation to use ordinary and proportionate means to preserve his life. And this is something that is difficult and yet reasonable to understand. Proportionate means are those that are considered doable, obtainable, tolerable, and they will be of benefit and do not give an excessive burden to the family or the community. And certain things that are considered ordinary and proportionate are things like hydration, nutrition, shelter. So we feed the person, we clothe the person, we put a roof under their head. These are things that are considered supportive. But what is considered extraordinary or disproportionate? Things that prolong life, that are creating sort of a synthetic form of maintaining the life. This is medical devices, perhaps a dialysis machine, a breathing machine, a ventilator. We can do anything to maintain organ function so we can harvest the organ later. Blood pressure maintenance, in other words, a person's in the ICU, and we keep giving them medicines to maintain their blood pressure, and it has no end. If we stop the medicine, blood pressure drops, the patient dies. But there's no automatic regeneration of that by the blood pressure maintenance by the patient on his or her own abilities. Maintaining core body temperature. If the body is no longer able to do this on its own, and all we have is warming blankets and all that, that's a burden. We don't want to do that. Ventilation, dialysis is what I mentioned before. These things can be chosen if they are helpful, but not if they're the only way to keep someone alive. We can refuse extraordinary means. We can refuse them to begin with. We can refuse them after we find them no longer useful. For example, a simple one I want to give you is dialysis. There are a lot of people go on dialysis because of several reasons. Damage to the kidney, diabetes, high blood pressure, whatever. Let's say a person's been on dialysis for 10 years. And now that person has lost, let's say it's a gentleman and has lost his wife, his kids have moved far away, he lives alone, goes to the dialysis treatment 3 times a week, but he has no life. No one visits him, no one does anything with him, and he's tried, but he's at this point, all his friends have died, he's got nothing. And he says, it's time for me to go. I'm just going to let nature take its course, and it's okay. My husband's a kidney specialist. We've gone through this with the priest. We've gone through this with our bishop. We've asked, and the National Catholic Bioethics Center, is this something that a person can decide to withhold? And the answer is yes, because it is now creating a burden on that person. And we don't want people to suffer during their treatments. There's other examples of that, such as a ventilator, as long as we prove something. However, we are not free to neglect ourselves. We must use things that will sustain us. You cannot starve yourself. You cannot withhold fluid. And that is and we must use everything that is reasonable that we can tolerate. And once again, it's nutrition and hydration. However, we do not need to maintain things that aren't good for us. One of the things that I've discussed with people are feeding tubes. Feeding tube can keep a person alive by giving them nutrition. However, a feeding tube can become very, very burdensome because they get blocked, they have to be replaced after so often, they leak, the family's constantly struggling with managing that feeding tube, and sometimes it's just too emotionally difficult for the patient and the family. And those things, as long as we're giving fluids another way, through little sips or something, we can do that. But the feeding tube is one thing that can be considered extraordinary, and that can be turned away too. So we can do things we can do things to withhold if it's burdensome, if death is imminent, death is unavoidable. We want the patient to be allowed to die because it is something natural, and it is a result of a terminal pathologic condition. And it depends on the situation, finances, family, physical state, mental state. If we know that a certain treatment is going to cost thousands of dollars for a patient, and the family doesn't have thousands of dollars, that patient can refuse it because he or she wants to eliminate that from the family burden, and that is accepted. We cannot allow a patient to forgo things if their mental state is not stable. For example, if they're in despair over something else, if in the despair of the diagnosis, we need to counsel them on the diagnosis, give them a chance to recover from that, but we should really not allow them to just go into the decision for death based on despair, because that is the wrong time to do it. This is why doing an advance directive at the time that one is considering what one is going to go through at the end of life, we should do it when we're healthy and happy. Because this is when you can direct your family members to what you want. And it's very important to have a medical power of attorney to guide not only your family, but your doctors. Redemptive suffering is one of the reasons that we should consider the value of suffering. I'm bringing this up, it's in your booklet, but I will have to tell you, I have studied this for the last 9 months, and in depth in a course called the Salvifici Doloris by Pope St. John Paul II. And I have to tell you that the value of redemptive suffering as described in Jesus' suffering is very difficult to understand. But I do want you to look into this, talk to your priests about it, because there is a value in suffering that may give us a shorter time in purgatory and may be worth it. So consider that euthanasia and suicide are not allowed, and that we must understand that we are of value to society and to our families, and that we should not take away from them the opportunity to show their love for us by caring for us, as hard as it is. And I know my time is up, and I'm so sorry, but I'll take questions. Okay?
Got a great burning question, that kind of a question for the whole audience. Anybody? If not, you keep going 2 more minutes.
I can go 2 more minutes.
Keep
okay.
going.
Physician-assisted suicide, I'm thoroughly against. And the reason I'm thoroughly against it, it's because it's beyond the scope of what we as physicians are supposed to do. We're not supposed to erode the physician-patient relationship. In other words, when I take care of somebody, I'm supposed to be morally engaged with them so that I can provide the best for them in their health and their future. And when I take that away and I cut off their lives, I have completely disregarded that. When we accept physician-assisted suicide, we then go to the next step where we now determine that we decide who has the value of life and who is worth living. And now we're saying that people over a certain age are not worth saving. It costs too much to take care of older people. It takes a lot of time and effort. The hospitals are very expensive. And it increases the possibility of abuse because now we value that person less because they cost too much to take care. And this is what's happening in many socialized medicine countries such as Canada, because now things are being withheld from the population as far as treatment because it's too costly. Now in Canada, if you want to have a chemotherapy or some form of surgery for a cancer treatment, you are told it's too expensive and we will not cover it. You're on your own to get it yourself. However, we will be happy to pay for your physician-assisted suicide at 100%. And this is done not only in Canada, but they're starting in states in the U.S.
Mayra, I did have a gentleman who had a question over here. Can you briefly address DNRs? Do not resuscitate orders.
Yes, okay. DNRs, which stands for do not resuscitate, okay? DNRs are accepted in certain situations. When we tell you that a condition is terminal, a condition has no resolution. Let me give you an example. A person, if you have a loved one is in memory care, that person has no chance of recovering their memory, and their lives are becoming less and less aware of what they're doing. If those patients go through a heart attack, let's say a respiratory arrest, it is perfectly okay for that person to say, or the family to say, this is a do not resuscitate, because you are prolonging that life for what purpose? That person this quality of life is not there as it was before. However, that person is not a candidate for physician-assisted suicide or euthanasia. A DNR at a hospital. If a person is in the ICU and the person has no reasonable ability to recover from a certain condition, we talked about total brain death. DNR is perfectly acceptable, okay? If a person is destined to be on a ventilator, and the ventilator, for whatever reason, stops working, and the family knows that person has pulmonary fibrosis, the only way that person's going to live is to get a transplant, but that person is now 82 years old and there's no transplant available for them, it's okay if that person arrests, do not resuscitate. All the issues we consider are, the most important ones is there a reasonable solution? Is there a burden that is tolerable? And is there some form of cure that is in the near future? And any treatment that could be experimental, is it easily tolerated, and does it have a reasonable chance for success? If it doesn't, the family, the member, has the right to say, enough, DNR. You can say DNR anytime you want. You don't have to say, I'll take any treatment. Because if you have a heart attack and it's something that you know you cannot tolerate because of medication or whatever, you can do that. Yes? I have a question over there.
We are asked to sign a DNR before any of these instances come to pass. Is it okay for us to blanket sign a DNR before we even know what the circumstances might be?
No. And let me tell you something about hospitals. Thank you for asking that. Right now, hospital administrators want to have every possible scenario covered, okay? And okay. Hospitals administrators want to have all this in the works when you come in. You don't have to have it. You do not have to sign it. You do not have to sign it ever. What happens is, if you don't sign it, you will be resuscitated. Now, what happens if you're resuscitated, you're intubated, and we find out that you have no reasonable chance of recovery? At that point, the family says, we're going to let things go, disconnect. But every effort is made to make sure that you are not in a recoverable situation. But you do not have to ever sign that when you walk in. And if they tell you you have to, say, no, thank you. They cannot force you. They always want advance directives. They want a living will. I don't have that yet. It probably would be good for you to have one just because you want your family to know what to do for you. But if you don't have it, it's okay. Don't sign something that you have not reviewed. Because what happens is, then someone else who you do not want to make a decision for you will make a decision for you. So if you have some good-hearted person who believes that you just shouldn't suffer anymore, they'll turn you off, or they'll give you a nice hefty dose of morphine. Okay?
Thank you so much, Mayra.
Okay.